Now I want to show you how to train the evidence and make that more evident to your end users and the people who are actually using the tools. In my experience as a trainer, I work with several different groups. I have the privilege of working with librarians who have been very active in promoting evidence and working with nursing councils and nursing research boards. And some of the organizations that have magnet status have different types of nursing councils that the librarian actually sits in the meetings every month and participates in the meetings. And I've been brought in to do training in those meetings. Most recently, I was at Baylor Health in Dallas and participated and did a training session for their nurses on the JBI database and implementing the evidence at the bedside. So again, Bonnie Arnold from Adventist Health is very active in utilizing the Ovid resources in the Nursing Council, and so these are just some different ways that I've been able to see how librarians really interact with the staff in both clinical and faculty and implementing the evidence. When we look at doing the training, one of the most important things that I found is in the first few minutes of the training session, it's really key to identify where the audience is. I found so many people sit in an audience for training and they don't know what the training, they don't have the background for the evidence, or they don't have the background for understanding who Joanna Briggs is. So I spend the first few minutes really bringing their education level up so they're receptive to learning the information I'm about to train on. And if they don't know the content, then there's no conceptual knowledge development that happens from that training. So that's part of a big piece of it. The other big piece is really the pre-session thing that happens prior to my arrival. I do different things working with the librarians in promoting the sessions and promoting some of the learning prior to when the training actually happens. And then after the training, there's a post follow-up too. Anne shared with you some of the brain sharks and some of the learning knowledge tools that we have as part of our learning resources. And those are some of the things that we use ongoing, both prior and post training sessions. These are a couple examples of the posters. One of them is really kind of neat because it shows how a library has actually advertised their resources, not the training per se, but the resources that they have available. The other one was a session that we actually did, and so I helped the librarians create the posters and then advertise the session to really get it visible. They use this both electronically and they post it throughout the facility. Probably one of the funnest things that I get to do is when I go to hospitals and I do training with hospitals, we've got a couple of different things that we've done on approach. And the librarian has been key in making this happen because she works with the nurse educators and schedules for me to go unit by unit. So I could be on a 7-story hospital and I'll start at the 7th floor and I'll go to every unit and do chair sides with the nurses and showing them exactly how to extract that evidence within 5 minutes out of the content. And it's been really successful, and the hands-on has just been a really big piece of being able to get the information in their hands. And they love it, and so I really enjoy doing those. The other ones would seem kind of funny. The doctor's lounge actually does work very well. It's kind of successful. I sit in the doctor's lounge, could be anywhere from all day to just a few hours, but really engaging them one-on-one, sitting them down in front of their computers and talking to them one-on-one about looking at the content either through Ovid or through our resources. And I'm amazed at how many of them really don't know it. And the librarians are too, because a lot of times in the hospitals, the library is right next door to the medical doctor's lounge. And so not knowing the resources that they have and being able to put that in front of them is really big. And then again, probably the biggest piece of that is not only doing the chair sides and not only doing the office the doctor's lounge visits, but being able to really follow up with that then, and the tools that I provide the librarian post-training sessions and being able to kind of keep that together. And it's really about the workflow. You know, I mentioned the doctor's lounge, I mentioned the nurse's station. I have a hard time standing in front of a group of nurses and expecting them to listen to me for 30 minutes when I've taken them away and out of their environment and interrupting their workflow. So this way I can be on the unit, I can work with them, I can talk about, you know, what patient maybe was recently presented with something that you had questions about. It's real life, it's much more livable for them, and then plus it has a much more sound knowledge development, if you will. So I really like that, and so the workflow is huge. So this is an example of a clinical decision support tool at point of care. And we have Oliver Tremblay, an RN, who's actually at a patient's bedside looking up the information through the JBI database, one of the best practice information sheets, and he's retrieved one of the algorithms that he's using at point of care with his patient. Some organizations have actually taken these algorithms and they're making them part of their everyday workflow in the patient's room or the nurse's stations, but these are all the tools and the support that product gives them at the bedside. And we talk about training on a lot of the Ovid products, and JBI, of course, we really believe is a must-have, and especially the JBI tools. You can't implement JBI successfully into an organization unless you have training. And it's really important to do that from the very beginning and have that done in a way that is relevant to the users. And so I can't stress that enough, how it really becomes a must-have training situation.